sideline, where I suggest starting, this is actually from Sarah's advice, because working in sports for so long, I tended to actually start at the legs. But I think that this format meshes much better for everybody, including, doesn't matter where you're at. One talent is moving hair, right? Drawing the hair up so that you make sure it's not like pinned and stuck underneath. Now we had talked some about the main muscles of the head, occipital frontalis. So frontalis here on the forehead, occipitals right here on the posterior side of the skull, on the occipital bone. There's going to be a lot in this. Going to be a lot of a push and a pull based action. I have my feet wrong. It should be my push. I'm kind of keeping it a little bit robotic so you can see. There's something to be said for just long holds and then just change. I'm just trying to grip as much of the skin and scalp. So I'm not trying to glide. I'm trying to move the skin of the scalp with my hands. So I compress both sides and then move in one direction, move in another direction. Create a frowny face, create a surprised face. The one that I do the most tends to be related to the occipitals and the temporalis muscles. And that's the one where I kind of turn my hand over. I do this just so my hand doesn't end up in there, my fingers don't end up in their face. All right, if I turn my hand over, it's the one place where you really pronate and internally rotate. It's not a lot of pressure, but then I can let my palm pull everything up and away from the jawline, away from the ear. Those tend to be the lines where most tension occurs. It tends to get tight at the temporal mandibular joint and near the ear, which honestly the ear is strongly associated with the jaw joint, but that's a comparative anatomy there. Temples are involved with the jaw action. That's what they're all about. So another comparative anatomy moment would be if you look at animals that have a strong bite force, they have big dents on the sides of their skull for big, really big temporalis muscles. So when people have TMJ issues, you don't have to always worry about masseter. Masseter is important. Now that's lower. You can find that pretty easy. But I tend to find that yes, a little bit of work on masseter is great, but I've had much better and more pleasant benefits for clients working more on the temples. And then having the person incorporate jaw movements. Like shear the jaw back and forth, open and close. Usually the shear back and forth is the bigger one because people tend to be one side jaw dominant, and that causes a lot of the problems. Well, that's sneaky. But really, I'll just turns into a nice head squish. The more of the scalp you can move while doing this, the better. And the fingers here at the back of the neck, I do incorporate a little bit of work with fingers here with no real intent other than for it to feel good. I want it to feel really good. And if I have a general formula of what I tend to be trying to accomplish is pulling things away from the jawline and the ear. Come around the posterior side of the body. Now we will move this towel out of the way, but I can leave the bulk of it along and across the chest line. And I'm going to start with palms, but then we're going to get to forearms. I'm determined, you guys are doing great, but I'm determined that everybody really tries to utilize a forearm first, as much as possible. That being said, superficial applications, like your initial contact or things like lymph drain, I think it's okay to use hands there. But then as soon as you're getting into deeper aspects, you got to start shifting. And you really should think, how can I use a forearm as much as absolutely possible? I promise you that's the number one way that you're going to be able to have longevity. my formula is a little bit, my pattern's a little bit different. I tend to start with something like this, and then I'll step back round. I move a lot. Like, I do a lot of back and forth. I feel like I'm always walking in half moon shapes, crescent shapes.
Okay, cool.
And
that's how I feel too, because I feel like I'm moving so much.
It's footwork. It's good.
It's like you're supposed
Yeah. Good footwork. Now, here's where a downhill is okay. I have to check the pressure, right?
Yeah.
Okay. I can't be too high. I have to be, in this case, related to overall orientation, I have to be below or closer to her neck than I am to the shoulder joint. I want to be, in this orientation, it's like technically medial to the acromion. It'll seem like you want to be below the acromion. You just want to be on the bony aspect of the scapula.
Is that pressure downwards to the floor?
Yes. Since this line, this hill is so steep, it's a place where going downhill is okay. You start your application high, and then just let gravity win. What that looks like and feels like for me is it feels like I'm starting here and then doing that. It's this way because I'm trying to stay posterior. Remember that these muscles run a touch more posterior. You don't want to be very lateral, and you certainly won't want to be anterior. So keep your applications posterior. Her orientation on the table. Head slightly flexed, and I'm standing behind her head in order to keep my applications more posterior. That being said, do you need another pillow?
I don't know. Would it be better for you if I had one pillow?
Let's see if you're more comfortable. It's
Okay.
okay for me either way. This is tough better. Remember that face cradle cushion.
Yeah, but it's not just
Yeah,
about
it's good.
comfort.
Yeah, that's better.
It's also about stretching muscles.
Sometimes, so that's where if you were talking about stretching.
No, what
When
I'm
you
saying is it's not about part of it is comfort, but also it's proper alignment for the
Yes.
person.
And that's what I was noticing. The spine wasn't very neutral.
Which
So-
is comfortable for me since I sleep like that.
Yeah, a lot of people will be comfortable, and so they won't distinguish that they need it, but they won't be uncomfortable with the extra pillow.
Yeah.
So I tend to suggest take your small pillow, put it on that face cradle cushion. The divot of the face cradle cushion will hold the pillow very nicely.
So, what I was thinking of is, it's good for comfort of the person, and the person should be comfortable, but it's more important also for the alignment.
Yes, because neutral
Or what?
spine as much as possible. That's why the square bolster is good for the low back, and why this extra bolster is good for the neck. Now you saw me switch. I did downhill, I was standing like this. Myself go downhill, I take a little step. Now I'm going to be working transverse to the spine. My forearm is not at a 90-degree contact. Elbow angle increase, so I'm more posterior. I just hold the temples a little bit, not cranking the head in any way. It's all about this arm, so pay attention only to the forearm. I'm just stabilizing the head a little bit. And then just gliding across. Over time, you'll be able to get more and more precise with your forearm, where I can work and get to the levator scap base attachments, or I can work my way up into the cervical neck area and be more on the erector spinae of the neck. There's more muscles for the neck, like splenius capitis and splenius cervicis. Lots of muscles related to extension of the neck. Let my wrist relax. And I can slowly work my way higher and higher. So I can use two or three forearm applications along the cervical area and cover pretty much everything. Now that's in this orientation. She's laying on her right side, so I'm working on the left side of her body. Right now I'm using my left forearm for those applications, for upper trapezius, levator scap, and then for all the cervical muscles. Then I switch my forearms for this one. I initially make contact with the tissue of the shoulder, but called like upper trapezius. That's just for creating a nice sensation. But I want to make contact with the skin and create the impression of a glide as I work up into the neck. But my main goal here is to find the suboccipitals. So I'm doing this very light pressure application because it feels nice. Holding the arm, stabilizing the arm, finding the base of the skull, finding the suboccipitals. Then I am not pushing more on that angle up into the head. Once I find the base of the skull, the occipital bone, I stop and try to drop my pressure straight down into the table. Right there, I found the occipital bone. I reorient a little bit, my pressure is very light right now. And then I sink just straight down. Now, here will always be sensitive. An incredible number of layers of muscles.
Is that where you can do the eye rolling?
Yes. Oculomotor reflexes. They exist everywhere. Where your eyes move, your muscles prepare to move you in the direction that you're looking. If you look down, all the muscles that could move you in the direction that you're looking pre-engage. But it's more, even more reflexive at the base of the neck because of the fine actions we have to do to stabilize our head relative to the horizon. So.
Now, what is the correlation between the muscle and the eye? Like, is it to like relieve a headache to like move them around? Or?
Yes,
Okay.
because what we've done is created a situation with reading, computer work, driving, is a lot of static head positions with tracking eye movements. And so the movement correlation that should exist in nature, which is I look in direction, I move in that direction, we don't use. We leave our next tonic. So these reflexes occur and the muscles get tight and stuck together. So one of the nicest way to be able to relieve especially tension headache related to eye strain is compress here and do the eye movements because we're trying to get these muscles to be less active relative to the eye tracking movements. Because they really should only be more active related to movement. But they get confused because you're looking in lots of directions like they think you're moving in that direction, but you're not. All right. Now, always though, these will be sensitive. So if I'm looking for tension headache, and I think you are a little bit of a headache person, aren't you?
Mm-hmm.
Okay, great. I mean, not great.
Wow.
Not great.
Wow. You're a
I'm
headache.
happy for you.
Your pain brings me joy.
Always though, as you work here, and you should do the pressure check multiple times as you're learning this stuff. But start sinking in and tell the client that this area, it can be quite intense, but we want it to be just the right amount. It can be quite intense, but I'm going to slowly push you. Tell me when it's just perfect. Okay? I'm going to keep going.
Good.
Okay. These muscles are so dense that you're going to have a little bit of a harder time gauging exactly what depth you're at. Okay? So you need their feedback if you're going to be truly working at the base of the skull. And I don't know if I'm deep enough to be on the suboccipitals. I think we're a touch more superficial. But upper trapezius, levator scap, those splenius muscles I mentioned, they all attach on the base of the skull too. So related to this idea of unsticking layers, if I'm even on those superficial muscles more, but I have her engage muscles deeper, we're going to create some kind of friction to get those muscles to unstick. And yeah, the eye movements, so big circles with your eyes, circles in one direction. You won't always feel it, but in her case, I can feel actual contractions occurring. And switch directions. And good. Now I'm pretty posterior. My elbow angle is increased to make sure I'm as close to the spine as I can be. And I just have to extend my elbow, flatten it out. It'll feel as though you're moving towards the ear. and that'll take you to the rest of the suboccipitals, and you may even influence a bit of sternocleidomastoid. And how does this spot compare to the first one?
Oh, maybe a little less pressure.
And start.
I mean, it felt good at first,
Yep.
then it started to get a little.
My
intense.
best suggestion there, because again, this is a very sensitive area. Come back out and do the action all over again.
Reset.
Here. It's a challenge here because I get talking. That should be better.
Mhm.
Okay. I'm actually paying attention. And train yourself. Okay. High movements. You have a direction if you haven't already. And good. And a swoopy. And kind of just roll. And then we're on to the next area. And moving our way down. Oh, got the face. This fluorescent lighting, that might be nice. Would you like an eye mask?
No, I'm okay.
Pillowcases can be eye masks. So if ever you're in a brighter lit situation, always consider that. And here's the thing, this movement. Now, probably to start, this is the easier one for everybody. But we have a towel here. We're gonna work on the lateral side of the torso. I'm thinking latissimus dorsi and deep to it, serratus anterior. Now the challenge here is getting on past the lateral line of the scapula, the lateral border of the scapula, so that you're initially more on the ribs and then pulling towards yourself to push the scapula out of your way. You're actually pushing the scapula a bit into retraction so that you can get a better angle on the thorax, so that you're more on latissimus dorsi, you're more on serratus anterior. It should feel like you're pushing the scapula out of the way and you're more on the ribs. And you're really high up. Like, look, I'm right up at the shoulder joint line. Now from here, I can incorporate some movements. And so you can do horizontal abduction. We're already in a little bit of abduction. Here's even more abduction. 90 degrees of abduction, shoulder joint, beyond 90 degrees, scapula, some extension, and horizontal abduction, coming down into regular adduction. This is what I tend to do for people. Like, I don't do a lot of the stretch. This can feel great. A pennant stretch here can feel really good, don't get me wrong. But if you want something that I feel tends to be a bit more gentle and also effective, let the arm just sit right on top of yours, and this hand can hold the sheet, with a towel in this case, and I can just roll the whole scapula around. The arm is going to move with me, but I'm not turning this into a glide. I'm really just trying to compress the whole lateral side of the thorax and latissimus dorsi. And then I just roll her scapula, the whole shoulder girdle, around, combined with my compression. And if I found something there, then I could get more precise. So if I had somebody with issues, now this is the other thing that I have done positionally. Have my arm set, I just let my wrist come into extension. It may or may not work for you. Depends on like your limb ratio to their limb ratio. Same thing. Now, if I found something, in this case, if there's an issue here, maybe it's related to latissimus dorsi. I just have to say, okay, you're gonna push your arm down into me. That's a concentric action. Okay, slowly let go, and then bring your arm up over your head. Look for a nice stretch. That's contract, relax, antagonist, contract. But having her actively move into the stretch is more effective and it's safer. So push down into me. Not so hard.
It feels good.
Okay, good. All right, good. And then up. Look for that nice stretch. Now, as she's stretched, I glide, because she's literally pulling the tissue underneath my forearm. Works really good. Now, if we had a serratus anterior issue, which may be related to scapular stuff, that is a protractor. So if I hold the arm like this, I just have to ask her to reach out in front of her. So go ahead and reach for the wall, good, good, and then pull the other way, pull back the other way, good, and I'm just resisting that pull. Okay, reach, and pull. And good, go, and then back down. And that right there is a pretty good starting point for you in relation to addressing the adductors and the protractor. And believe me that serratus anterior can get really overactive related to chronic shoulder issues or any shoulder injury, because the body puts you in that sling. And part of this action is going to be adduction and protraction. So you got to unstick that line back there. All right. Now we're to the new stuff, the amazing arm and sideline. It frustrates people because if you just leave the arm there, we got you all kinds of, there we go. Gotta be able to breathe. It'll seem like it's just sloppy, right? So the challenge is, where do you stabilize while you do this work? Pretty much it's gonna be hold near the elbow. If I'm working on the upper arm, I'm going to stabilize just distal to the elbow. I'm holding onto the forearm. And here, I could do all these nice glides, but I've got to hold that arm down. You can get some nice kind of secondary shoulder movements. Now I'm showing this, it's not something I do very regularly. So this feels very clumsy to me, okay? Kneading actions are the ones I tend to defer to here. And I have to use a touch extra hand strength, because this is my way to show you one option of at least getting this, all parts of the arm, is you have to reach over and get the biceps, the anterior side of the arm and the posterior arm, and just do a really good slow knead. And that all by itself, you can try to trip, that all by itself tends to be all you really need here. You get both sides, and one is stabilizing the arm for you. That pull hand is stabilizing the arm, while my push hand does the work. It works pretty good. The forearm, now we're going to stabilize the whole humerus and just massage their forearm right on their hip / pelvis. It's not perfect. This would not, I mean, there are some people that do prefer side lying in general. Like Sandy is one of them. So she got really good at doing all the arm stuff in side lying. I still find it a bit awkward. I can figure it out, but it would not be my first choice if I had the option to do prone and supine. And we can just leave the hand here. I could do this, but I sometimes don't want to just have their arm constantly in extension while I'm doing the hand massage. I'll do the hand massage from the other side of the table. But pretty much that's all there really is to this one. It's hold the arm down, you can use a forearm. Pretty much you're getting the triceps and the line between the triceps and the biceps here. But then you can get the biceps and the other brachii somethings like coracobrachialis and brachialis and brachioradialis here, and then even at the forearm. Just knees. And reposition, the towel's right there, arms nice and cozy. If I swing around, I'm sorry, I should have that hand again. So come back here, then we can work on the hand here. And we talked a little bit about some specific tactics for just helping issues related to the hand, and it's that shear action of the metacarpals. If I'm being more precise, it's where, when I'm gripping, my fingers are trying to be just between the lines of each metatarsal. So right now, I'm thinking just the 5th metatarsal. Then I go to the 4th. Then this hand, I'll stabilize and I'll think about, I said that wrong, the 5th, the 4th, the 3rd, the 2nd, the 1st. It's just hard to see. I'm gripping, trying to only move the pinky finger, 5th metacarpal. Then the ring finger, 4th metacarpal. The thenar group will always need more work, and the hypothenar group will always need more work. So if I pick anywhere to grip, it'll be around the 5th metacarpal and the 1st metacarpal, and then I'm squeezing like this, using my fingers as the counter pressure. And then my palms can spread out and away across the top of the hand. And it works good and it feels good. Then for the individual fingers, this transitions very nicely. Any golfer or tennis person would be familiar with most of your grip strength occurs with these 3. So leave your indicus and your hallucis alone. All right, I'm gripping with my 3rd, 4th, and 5th phalange, and then using the rest of my palm to do this. And you can usually squeeze as hard as you probably could, and it feels great. I'm not a fan of tractioning. With arthritis, especially rheumatoid arthritis, you don't want to be tractioning. In a sports setting, jammed fingers were like a constant. But the squeeze creates a mild traction of these joints. So if something does need to shift, or if they want that sense of it stretched, this will do it, but it's much safer than you pulling on things. Just squeeze. So thumb, pinky, 1st, and 5th, then 2nd, and 4th, and squeeze. And I'll do 1 squeeze, or I'll do 2 or 3 squeezes. One that's closer to the metacarpals, more proximal, and I'll do another set that works more distal. And then the 3rd, and since the thumb is so special, the thumb gets another. And there you have it. Then the hand can go wherever it's coming. One option for the arms in this position, the only thing about this is that it's a touch awkward because you make a lot of face-to-face contact here. But you could work on the biceps right here. I prefer to stand like this than to stand like this. One, so I don't get those nerves. Also, so that we're not breathing at each other too much. Here, with my arm kind of as a block, feels a bit more private for them. But I can grab here and get those biceps real good. Roll that shoulder. Works fine. If you see pictures in the book of working on the rest of the forearm in this position, be careful with bringing the arm to the table. I certainly can't do that. I'm limited in my shoulders, and that's because I have some dysfunction. So what you would need there is some additional bolstering in order to make that safe, okay? And this is where a bigger pillow inside line makes a lot of sense. Like a big standard size pillow for the head, because then I could rest the hand right there. I tuck that, and I'll see I could work on the rest of the forearm. It's not perfect. I'm going downhill, good switch. So, you have to be more thorough on sideline, you absolutely can. This orientation, and this one. Then you'd have access to the hand again. Do it all again. Squeezes, squeezes, and you're getting a little bit of a stretch with your fingers in between each of those. Voila. All right. Now, that's a bit disjointed. The way I usually work is not doing the arms in supine, and I'll do like the kneading action on this top arm to get all of it. Now to get the back, what we now need to do is actually have her roll forward a little bit for me. Roll a little bit forward. Now I have this, and she's already pinning the sheet with her arm, and I have this towel covering the rest, and then I can move the rest of the sheet. Now we've looked at working on the low back for that lateral raphe and QL release plenty, and she doesn't have low back issues, so I'm not going to worry about doing a specific QL release just because, right? We're going to be doing just a back massage that's part of the full body protocol, not specific to an intervention, just so that we do the actual full body. We get our lotion distributed. Now starting on the low back, we can work on the side of the body that's away from the table, the top part of the body. Here, I can do some glides. I go across the low back, and I go right to the pelvis, and then maybe across, working laterally. Just a bit. Again. Here, and we position. It ends up feeling like I'm working very similarly to when I was on the neck. You see how this hand, if you don't know what to do with it, just let it make contact. So just for the lumbar area, glide that goes towards the pelvis and the one that tracks lateral, going across. The rest of them, you could keep that up, but I find this to not be, I mean, it's okay, but I don't think it feels as good. And it's more awkward for me because the angle of their body is so extreme, right? So I don't have a very good hill to push into. This is the best place to really get good at using the soft fist. Remember, soft fist, fingers, they don't curl in. Don't do that. You should be able to see all of your fingernails. I see them. All right, now my contact is going to be at the spine. I find the spine. I'm going to be just lateral to the spine, but I'm on the side of the body closer to the table. So spine, soft fist, and then I just let gravity pull me towards the table. This one at least we practiced. And you can do either one. It can be the right hand is my push hand. My other hand is on the side of the body above. So I'm on I do have this hand on the left side of the spine and this hand on the right side of the spine. This hand is just stabilizing. The work is occurring here. What it will feel like is the massage is like spreading everything away from the spine. But your focus should be the push hand, the lower hand. Stabilize, push, elbow straight. Here, right foot forward, right hand is the lower hand, and then just let gravity. For people that need a lot of pressure, then you can kind of use your knuckles a bit more in a targeted way. And I'll just ask pressure. Tell me when this is right.
Good.
It's already good. Okay. there is no other way to work on the structures of the spine that pull everything away from the spine. And the connective tissue lines and anchors running up and down the spine go superficial to deep. And in many cases, this would be probably the better way to work on the erector spinae and the paraspinals. If there's been back surgery and there is scar tissue, this is going to definitely be the better angle to work on, because you'll be pulling the scar away from the surgical site, the spine. You want less lotion, maybe no lotion, in order to pull that off. But I can just work my way slowly from the lumbar area up the thoracic area.
Do you go down until you hit the table or almost hit the table?
No, I don't even go not even that far at all.
Oh,
I'm visualizing the erector spinae.
It can get pinchy if you go too far.
Yeah, no, very good question. I am starting from the spine. I've gone only about that far.
Okay.
So call it 3 to 4 inches. Yep. No, my main goal is think about muscles of the spine. I can get latissimus dorsi up here. I can get the lateral fay up here. This side of the body, only worried about the erector spinae and the paraspinals, which is also the key area where people that want lots of pressure, they'll want the maximum amount of pressure you usually can deliver. There and sometimes the legs. But most people, they want a ton of pressure along the erector spinae. And this is just the easiest way where you can get really good leverage. Use a sharper point of contact. This is the case where it's not the forearm, but it's not your fingers and it's not your palm, right? You gotta make sure you stabilize your wrist and let the transfer of weight go right through your stable wrist into your knuckles.
Now to make it feel a little bit deeper, can you go less lotion, like to make it feel
Yep.
more intense?
Way more intense with less lotion, because you get that myofascial component, absolutely. And they also could roll back into you.
Okay.
So let's say they had a really particular spot, and I'm already delivering everything I can. And I say, okay, you should just roll back into me a little bit. Now what they're doing is actually activating those extensor muscles. This is already a muscle entry technique. I'm going to relax, go forward, and now the glide happens by itself. That'll make it more extreme too.
Yeah, for like those people that want you to basically stand on their back.
Yes, yes.
Sorry,
Good.
asking.
Have them roll back into you if it's really that, but don't do work some in prone, but don't hurt yourself trying to work on the erector spinae with max pressure in prone. You will hurt yourself. So save your time and energy here. It feels great. I like to think so. Now here's the other one. Stabilizing hand on the, in this case, the left side of her body, which is the part of the body not contacting the table, and this hand, which is going to be the work hand on the right side of the body. And I tend to have them oriented like this. That's just so it's nice to my wrists. I don't want my wrists deviated, okay? They need to be set in neutral position, super stable, and then I am a robot. Elbows straight, wrists neutral. Wrists straight, neutral, that. And it's this. So contact, contact, both sides of the spine, and then I just pull. I'm concentrating on my lower hand, so hand on the right side of her body, pulling towards the table. Now, that would be, you can do that for the lumbar erector spinae all the way up. Now, once you're to the scapula starts getting in the way. And that's where I switch hands. So I used my right hand in this case, all the way until I'm more than halfway up the thoracic spine. And I'm hitting that scapula. Now I'm going to switch. Right there is the medial border of the scapula. Medial border of the scapula. It's the right one now.
Yay!
Medial border of the scapula. And I'm going to go from, instead of trying to work on it like this, I'm going to turn my hand over, still keeping my wrist neutral, but now I'm going to work like that. And this, because of the way the person, when you lay on your shoulder like this, it naturally wings the scapula out for you. So it creates that effect like when people try to claw up underneath the scapula and pull it away. I get it, but I would tell you it's much safer than doing this one. Where a person has your arm positioned like this and uses their fingers. One, I can save my fingers, and two, it's much safer on the shoulder joint. But in this case, I can use the knuckles of the soft fist to go along that line between the scapula and the ribs. I think it feels a lot better. So then I just come up. I start at the superior angle of the scapula, so think upper trap and levator scapulae, and then I'm just going to work my way down following that medial border. And it's real slow. Pressure okay?
Yep.
Okay. Does that feel like a few spots in there? Not too bad.
Actually,
Lower down?
up more.
Up more.
Yeah, where you were at.
Starting out.
I'll tell you when.
So this is part of the assessment, starting out. I thought I felt something and then I didn't get it. So we'll see if I was right or not, but let them be your guide a bit. And really you're gonna only need to be that much more precise when it's an area where maybe they have symptoms. This isn't a common area for her. She's a tension headache person and has like the foot stuff. But remember that stuff related to the head, there are muscles that are associated with the scapula that go right to the base of the skull. So try to just remember maybe these synergists that could be involved. And if they aren't, then move on. Still nothing?
Right there.
Okay. Now, her arm is pinned. What do I do? Breathing. So big deep breaths. And the rib popped. And there you go. And that might have been all it was associated with. We're too low to be on rhomboids or serratus posterior superior. So we were probably on the erector spinae and feeling some additional tone relative to a facet joint just slightly offset. And then sure enough, breath, it clicked, and I can be proud.
Yay!
Okay. In this position, then we would just be to the leg. We're going to push to 12:30. Okay, I'm going to scoot. We've worked on the legs plenty, so I'm just going to do this in actual real time and stop myself from jibber jabbing. Here, if you're going to knee, make sure you stay low. Keep your hands directed close to the knee. See how my hands stayed like oriented towards the knee there? Once you're to the lower leg, you're good to go. This is where we can start breaking through some rules. I tend to use kneading as this way to do more superficial, warm up the superficial layers, the top layers, and distribute lotion. And then I transition, and I do it in the whole area I'm about to massage. So the whole leg, and then I go right into the bigger glides. So I used lighter knees across the whole leg, and now I'm thinking hamstrings, more posterior, then adductors, more medial. Hamstrings, adductors. Hamstrings, specifically semimembranosus and semitendinosus. Semitendinosus is on top of membranosus. And then the adductors. And I'm standing with my forearms already in position, so I just switch my feet. There's my forearm for gastrocnemius. Going all the way down to when it starts to meet the Achilles tendon. I do not need to directly compress the Achilles tendon. I'm worried mostly about my pressure being along that medial line of gastrocnemius. This has a lateral head and a medial head that like to get stuck together. The pressure dissipates and gets real light towards the Achilles, and I'll use my hand to finish that. Swoop around, try to pull gastroc away from the tibia. Other hand is just already going to be squashing away at the arch of the foot, pulling gastrocnemius off soleus. My intention is clear. The energy work will make it happen. If I needed to get more precise here, bring a forearm in. I know that she has some issues. Now, I've shown you in the past with the soft fists, so now I'm showing you how I'd be more precise with my forearm. Instead of using my knuckles, if there's ever a place where I kind of use not the tip of the elbow, not the olecranon, it's this ulnar ledge, okay? I'll find where the tibia is. I'll make contact with that bony part of my ulna, and then I'm just using it to grip and pull everything away. So I'm just finding the point, setting my elbow, and just drifting away. Then I think about those layers. I'm not now thinking about the Achilles tendon related muscles. I'm thinking about the plantar flexors and flexors of the toes. So the actions I can do is just move that first metatarsal around. Because not only is that going to move the ankle, it's also going to move the big toe. And I know that that's going to affect that deep compartment and get it unstuck from that superficial Achilles tendon related compartment. Body mechanics as I talk. I stay looking where I'm doing. You'll see how I square up more. This is what it should look like. Good. Here, cup the foot, forearm again. Cross the foot, perpendicular, parallel, perpendicular, parallel. I'm trying to be with this one, finding where the calcaneus is, and go right along that attachment site where you see where the plantar fascia and all that stuff attaches. Go right along that line. And I'll find the whole edge of the arch of the foot and kind of just squash that more directly, more of a direct compression straight down. But what it'll end up doing is pulling it laterally. Try to pull the tissue away from the arch. That's the goal. Doing it that way is really thorough, actually. And then I'm done. Now, people get scared here because it's draping again. Gotta remember to preempt any kind of potential window. Now I have this towel already here to help me, right? That's the window you don't want. So you just gotta make sure if you're draping for this, that you really bunch the sheet up to start. Make sure there's lots of sheet around the knee. You may end up pulling the sheet off of the foot. That's where you have this, and even if you don't have the other sheet, use the fitted sheet to cover the foot. Now I can tuck this. I'm not making direct contact with her body. I'm just using the bunch of the sheet to tuck that a little bit underneath the leg, between the leg and the bolster. And then I'm good. Get it to stay. Now the sideline, there's a lot of adaptations you have to make. And one of these is gonna be just watch, rather than me explaining, the weird angles I have to use in my forearm. I don't wanna be too much directly on IT band. Some people might like that, but usually what needs to happen is for the muscles that are adjacent to it to be pulled away, to unstick the IT band from it. So, needs. And really more, I stabilize and hold right at the knee. And then I have to rest my leg against the table because it's an awkward angle. That's the way I can get the quads, I can get up to the hip flexors. And as you've seen in my typical routine, I skip this part in the sideline and I get it in prone and supine. I get the upper leg more in prone and supine. But even for bicep femoris, the lateral hamstring, I can reposition the leg, bring my arm here, and try to draw that. Now it's real isolated, but I can draw the hamstrings, specifically bicep femoris, away from the IT band. You don't have to go high. Remember that attaches over onto the ischium, so it's just right there. I have to unstick that if there's an issue there. That's your tight IT band, people. Then we're here. This is where I much more prefer to work in sideline, because I can get almost every single muscle associated with the lower leg here in this one action. And that warmed up all those superficial layers. And I'm gonna switch, making contact with the foot, going right into a glide. And now I'm gonna think about the anterior compartment, like tibialis anterior and extensor digitorum. So my elbow angle is more set, so I'm more anterior to the body. Then I take a step, and I'm more on the lateral side of the body. And these are about inversion and eversion. So I switch my hand placement. Switch, anterior compartment, lateral compartment, interior compartment, and lateral compartment. And do that forever. And I reset the sheet, and then we go to the claw underneath and the top hand here. And this is where I can really get that shear for the interosseous and lumbrical muscles associated with the metatarsals. Say all that 3 times fast. How was your foot after last time?
It felt like it hurt after, but then it got better.
Okay, so how long did it hurt?
It was like a day.
That's on the threshold, okay? For more targeted work, for it to feel a little bit sore for a day, and the question is, did it get a little bit better?
It did,
And then
yeah.
stay better?
Yes, and then today it started hurting again.
A week. Once a week for the rest of your life.
There we go.
So maybe ideally we do a little bit less. I prefer you not be sore.
Right.
So ideally we'll find a way to be a bit more targeted yet not to the point.
Right.
However, if it creates enough benefit, then it's okay. Now, if the soreness lasts beyond a day, then it's too much. And you need to admit, well, that was too much, we need to dial it back. Ideally, you're not sore after a massage. If we are very targeted on a particular area, maybe It can be sore for a day, but it should be sore to the touch, not to the move. Now with feet, that's a challenge. With low back, that should have been more the case.
Yeah, when I pressed my hands, my hips, I could feel it.
You'd
but
feel it.
I
That's
felt
correct.
fine
That's
moving.
okay, because it's like you're influencing. You are kind of. It's not true injury, but when you're separating layers or you're influencing tone, it is a stress on the body.
Mhm.
But that's the kind of soreness is okay. Sore to the touch, not to the move, no longer than a day. Otherwise, you did too much, and you should admit it and change what you're doing. Okay. Knee up. Very good. You stay. People will try to roll too fast. All right. Now the arm. We have a towel there, so nice and easy. What's nice about sideline is you really only have to grip the one side of the sheet. All right. Arm out. What's the nice thing about the towel too is that it's already there to maintain modesty, and then she can pull her arm out and get it on top of the sheet, and you're good to go. The initial time when it's awkward is when you're teaching a person how this works. They've never been put in sideline before, then it's going to be a little bit messier at first. They're not going to know exactly where the bolster is and all that, but after they've seen this and felt this, then it all makes sense.
Can you go over the process of getting the arm out?
Oh yeah,
The process.
but the towel in the way is so helpful. So go ahead and stick your arm back underneath. Yeah, I can put the towel here and say, hey, just stick your arm underneath. I can find the sheet and help a little bit. You find your way underneath.
Yes.
Okay.
But see, but I thought, what happens is I thought it was, when I saw the process in which you went through it, I thought it was good because you just lifted the back,
Mhm.
and then you ask the person to move their arm
Yeah,
back.
and you could, and then I just hold it here, arm into extension. The challenge would be if somebody couldn't do that.
Oh, okay, so. all right.
Sometimes people can't get their arm in the
So
full
that's why it's
extension.
important, he's standing
Yeah.
behind the head, that way he's not getting a peek
Thank you.
into the sheet.
Yes. And ideally, all I have to do is explain to the person what the goal is. Your arm's gonna go on top of the sheet, then I can just hold the towel, and they can figure that out. All right. I'm gonna try to just go into actual massage mode here, okay? Oops, here. Okay, that, pillow, tall enough, comfy?
Oh yeah.
We need to
might
shift
move.
it, just, I was just gonna.
Yeah.
She knew that you want there to be pillow in front of their face, so that as I smush and their head is in flexion, they have somewhere to go. Alright. Over here. Figure out my orientation. It can get real boring to just watch. I try to fill the space with dialogue, but roll. You see how, like, as I step, I'm just working on areas as it becomes convenient. Towel. Don't do this too much, but there's something to be said for a little bit of a trap squeeze. Okay. Motion. And she's rolling back actually a little too far for me, so I'd have to say I'm going to roll you forward just a little bit. Okay, that's much better. And sometimes you gotta help hold them. I mean, if it ever becomes too much of a struggle, then you just may have to reposition stuff. I'm gonna lift your head up a little bit for me. There we go. That's why you see me do this, where I'll hold here. And it's not just me doing this. I tend to do this. Not just to kind of hold their shoulder in a better orientation for me. Okay, made contact. I made sure I wasn't on anything too bony, so I'm trying to do not want to be on the clavicle or the acromion. Just medial to that, so thinking upper tract, contracting down. Then once I get close to the spine, I switch, change my footwork. Now I'm going to be going across. So it's starting contact close to the spine and then drawing it lateral. And working my way slowly up to the lower cervical area. And same thing, contact right by the spine and then just going lateral. This is maybe an inch. Real slow, small glide. Higher up, the upper half of the cervical area. Okay, switch. Do a swoopy. Do a little bit of that shoulder roll. Hold the scapula down. Make contact with upper tract. Glide up. Wasn't my best angle. Reposition my feet. Searching. And my angle. There we go. Here we go. Finding suboccipitals, sinking into the pressures just right. You tell me. Good. Eye movements, one direction. Other direction, roll your eyes. Good. Big deep breath. Spot. Out there. Pressure. Eye movements. Roll in one direction. And then the other. Big deep breath. Out. Okay. Now we reposition the towel. Get ourselves here. My arm goes underneath. Oh, sir, would you mind grabbing a couple of the weighted blankets?
Yeah.
Just those little ones. It's not perfect. I can that ball and socket aspect. The glenohumeral joint rolling. I've moved this hand over just onto the scapula. Now, I can finally be thinking more about scapular movement. So take it up into elevation, hold on to depression. Elevation, depression. If I make contact with the lateral border of the scapula, then I'm pushing it into retraction and downward rotation. With my fingers, I can pull it back the other way, but usually I'm more worried about this. People get stuck in upward rotation and protraction, so they almost always need this for better scapular alignment. And arm comes up. Get the sheet just right. Myself set. Using a soft fist to distribute the lotion instead of a palm. And contact here. Finding the lateral border of the scapula again. So my elbow is past that, so that when I pull back here, I'm moving the scapula out of my way, and I can sink down and into Latissimus dorsi. Go ahead and push your arm down into me. Strong. And good. Go up. Look for a nice stretch. Up over your head. There you go. Yep, you got it. And down. Okay. Push. lateral run. Now if I want to do that all passively, start higher up, and then just roll. Good thing there, huh?
Mm-hmm.
Okay. You're going to be a bit more precise because of my awareness. So Latissimus dorsi. Here, now push down into me. Combined actions, you'll get there. Okay, up over your head. Hold, good deep breath. All the way in, all the way out. Increase that stretch. Great. Great. Okay, arm down. Now, wow, what timing? So here, 2 weighted blankets. They're 8 pounds each. So 16 pounds, right? If we had a chronic stress breather, which I don't know, you don't seem too chronically stressed.
No, not really.
So, but I can't think of a better tactic than just in here, and just leave them like that. Go do the rest of the massage. Start this off. I should have put these here first, and then I've been doing all this other work. And then I could push on top of this too. Sorry, the other thing, if I wanted to think just about breathing, we were looking at the anatomy, those 3 intercostal muscles. Do you remember that the pliability of the ribs is essential? The diaphragm can't work if the ribs aren't pliable. So, and people get stuck in an inhalated state. They need to be put down, pushed down into an exhalated state. I visualize an umbrella. The umbrella is open, we need to close it. So this is closing the umbrella, and then I can just be the extra bit of weight. And then what action would I have a person do?
Breathe.
Breathe. Big inhale, good long exhale. You want them to really concentrate a bit more on the exhale. No hyperventilating, but I want them to focus a bit more on the exhale. And at the peak of the inhale, hold your breath, couple of seconds, good long exhale. The holding of the breath acts as an isometric contraction as a muscle energy technique for pretty much everything related to the thorax. A big inhale, hold your breath at the peak of the inhale, and then good long exhale.
Would this be good for people that have bronchitis, COPD, or pneumonia?
Any upper respiratory, anything. Yep. If it's COPD, if it's a chronic thing.
Because I know COPD, they can have like that oxygen level issue in
Yep.
their body.
And now as long they might want to have the oxygen with them during this. But anything, asthma, just getting over an upper respiratory condition, panic attacks, and then you go into other things where maybe getting this more pliable, even for somebody with cystic fibrosis, along with the percussion. Just anything you can think of that would be associated with respiratory function and breathing. And you can relate it to either a specific condition, or you can think that it's just sympathetic dominance related to stress.
Even somebody who's been crying a lot.
Yeah,
Mm.
yeah, crying, absolutely. So it all gets triggered. So this is just a wonderful way to interface with it. And I can't think of a better tactic than to be able to let the weight of these blankets do the work. I can exaggerate it and incorporate the breathing as the intervention. And then this can just stay there as we do the rest of the massage. And I can't do that in prone and supine. You can only really get this action that's working against the whole thorax and sideline. So, worth potentially thinking about these weighted blankets is a thing to have in your wheelhouse. And it's independent from your skills. You just get to blop them and they're doing the therapy for you. And then you can insert in there the hot packs too. And you'll get to add-on day, but that's where you can be using these like everywhere. Hip stuff, hot pack plus weight and compression. Knee stuff, hot pack plus weighted compression.
Yeah.
Knee stuff, again, hot pack plus weighted compression.
And is that warmed right now?
No.
Sorry, I was
These are just the weighted blankets. So what these look like, let me pop them out.
Cause I know sometimes with the weighted stuff, they have heated things
So-
too.
Just sand and pleated. You could make this, if anybody is a crafty person, then just sand and pleat it so that it can't gather. But, yeah, they're a little bit expensive. It's a one-time purchase and you're done. And then inside of this, or under here, just put the hot pack, the microwavable hot pack, and you're good to go.
Guys, I have a sewing machine. Bring sand and let's go.
Yeah.
50% off some of that Joanne thing.
Yeah.
We just got to find an ugly one. Who cares?
Yeah. They do the good.
You go anywhere for continuing education?
Yeah.
You go anywhere for continuing education? Bring a batch of them and sew
Oh,
There you go.
all right.
People would love it. Weighted blankets incorporated.
Disposable income.
It's such a
Yeah.
great,
There you go.
such a great hack. I'm gonna have you roll
No pictures
forward.
Or as you put, mine's the girl.
So here's where we can get a better line for all of this. Let's see what my hands are actually doing, right? Oh, should have applied lotion too quickly. Gotta assess. Really do try, even if like it's like that, where I put a little bit on, like stop yourself and at least make that initial superficial contact. The temperature component of something jumping out at you being really warm is important, you know. So if something's really hot to the touch, there's potential inflammation. But if you put a hot pack there, it's warm for that reason. All right. For now the right side of the back is where we'll do our initial work, where I can just make contact. I usually just grab right onto the upper traps, stabilizing their torso, but also just to make it feel good. And then I'm searching, getting myself in line with the lumbar spine, and then letting my pressure take me towards the pelvis. Sometimes the sheet gets in the way and I untuck it. And then I'm going to go, and I switch my feet work a little bit. It's kind of a small adjustment on an angle towards the pelvis. Now going perpendicular to the spine, going lateral, trying to affect more of that lateral raphe. Okay, switch. I grab the trap to help create a transition. Go into that downward angle. And then track perpendicular. Now, I would not do this in prenatal. I don't want to be distorting the abdominal wall too much. What I would defer to is not doing that and going just to using the softest stuff. And I break out a little bit of a Swedish massage thing. Go, ooh. Now, once I'm here, the sheet will get in the way a little bit. I could drop in the knee, but the angle doesn't work very well for me. Wrong hand. And you could use either one, it doesn't really matter here. So top hand, just stabilizing. Bottom hand, doing the work. Top hand, bottom. Now it looks boring, but you can be real nice and thorough. And this can be the back massage. It really can. At least 90% of it. And the way I do a transition is I get to the end of this application, because I don't want to be pinching. So it only goes maybe about that. The excursion is only about that big. Once I reach that point, the little nuance for when I transition is I'll shift a little bit of weight into the other hand. So that kind of has more of a rhythmic quality to it. Here, shift, there. It's incredibly simple. Again, the nature of being able to pull, sometimes I have to check using my thumb, confirm where the spine is, find the spinous process. And then with the time allowing, you just do that a couple of times. You work your way all the way up, you go back down and do it again. Now I have found the scapula. I come up. So I would have done 2 rounds of that. And here, you breathe good, there we go. There. I'm not a very, my draping is very bunchy and messy. So right there, that whole medial border of the scapula. There's this superior angle. So that's right where levator scapula attaches. That's where I'll start my contact. And just make sure you keep that wrist nice and neutral. Take a step. Make sure that wrist stays in good orientation. Small footwork. I feel like anything from there.
Up more.
Up higher, okay. Just gonna finish this, we'll come back to that one. Okay, there, back down, kind of back up. It's just that classic levator scapular spot. Pressure.
Good.
Tell me when we really find something. We're not already there.
Right there.
See, it's so subtle, getting that, like I could tell there was additional tone, but we all know the difference of like being really close, and you just move 1 millimeter, and all of a sudden you're really on it, right? I mean, good breaths. All right, that's really moving. So this might be a serratus posterior superior. Feels like I'm deep enough when I feel the breath action. It really is contracting. Excellent. Then light pressure. This is just grazing. So like the pressure was here, and then once I reach this point, I'm reaching, and so I just make contact with the skin to complete the stroke, and then we're done. Okay. And I went to my old habits. This is the pattern shot. Okay. Here, bunchy. Knees directed towards the knee. If this was lymphatic drain, that would be completely different. Everything would be directed in the other direction. Okay, that. Switching. Hamstrings. Adductors. Hamstrings. And adductors. Sometimes the bolster gets in the way, so I have to make contact, and I just rest my hand right on their leg on the bolster. And I may have to switch and put my hand against the other side of the bolster. Okay, standing right here, I switch. Right on the lower leg. Well, can I get you?
No, it's all good.
Okay. That sleep-ish twitch versus a real twitch. Call it that. Pulling everything away. Everything away.
It kind of all hurts right there. Well, like a good hurt.
Yeah, this is your key area. So you're using that forearm instead of a soft fist here. that's right, you gotta be working, that's right, okay. I'll do a group of 3, that'll be alright. You can be in and out.
Yeah.
We'll do 2 groups, and then the other group that's just 2 will be the one that you can bounce back and forth. Alright, here, cross. Now, I'm not gonna be as thorough, she'll get on the table again as part of the demo, so I'm just gonna kinda, just so you can see the placements and stuff again. You can use a forearm basically everywhere, and it's just kinda be a bit more precise. So tuck, tuck, and you can do this, bam. Here. Oddly enough, the upper leg is my least favored. I didn't do the arms here. You saw them. On the other side, you'll practice it the rest. I thought it was more novel to just bring in the weighted blankets and show that. That's showing how I could get more anterior, the quads, and how I could get more posterior, the lateral hamstrings. Switch. Right here. Underneath. Shear, 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 shear. And do a lot more of that. This is all sped up. And done.